No.
Doesn't help there. So I have to try to get them funded, decentralized.
And they've been sending out a lot of surveys about how much of our things, how many AEDs have been provided with that. So that's kind of what I'm saying at the seat. Maybe they're really wanting to give us provided all of these. I don't know.
It actually makes a huge difference in survival. They could be immediately defibrillated.
And Lori isn't certified yet, but I think if I contacted Bill Jackson, probably the fire department, or he could come up with somebody that would help with training and educating of those as they were passed out. So it's something to think about. We also need to look at the ones here in the county building because they're probably 15 years old, 20, probably 20 years old. I don't either. I need to have Lori.
Probably cheaper now and probably better. I mean, as far as the bells and whistles that people like to do.
I'll tell you, I would have been afraid. Have you ever been trained on an AED? AED?
Yes.
I would have been afraid to just grab one off the wall and use it until I trained on it. It tells you everything to do.
Yes, I would have been too. No, we have that grandparenting classes the kids used to take.
Yes.
But the CPR that was very, very, they had a baby and they had an adult for us to, the
Well, now
names.
you don't have to do the breaths and.
No, I know, and
so
it's
much
those,
less
yeah, she said it just tells me exactly what to do, where to place it.
Yeah. How's it happen?
She's home. She's home. She came home Thursday and we've got some private duty nursing lined up. So that was kind of a new dance of having relative strangers in the house, but they're mostly nurses and the NICU.
Okay.
Wanted to come help us.
Dr. Pierce.
Hi. How are you?
Dr. Pierce.
Good.
I don't know, she is.
Hi, stranger. How are you?
Oh, wow, yeah. I was here last time.
Well, I was not.
Yeah,
Still strangers.
Glad we see each other. Yeah.
Yeah, I was in Texas and you were here, and when I was here, you were in another country.
Yeah.
I don't know whether it's expecting. Let's have that. There's a pen right there.
Oh, I forgot to put your name tags up.
I'm Barbara.
Take a roll call, Brandy. Oh, man, it's really picked up out there.
Yeah, it's cold, isn't it?
I'm so happy the sun's shining.
Oh, I know. It's like spring out,
I'm just
actually
gonna say
today.
it's sunshine. Yes. It's good.
Yes.
We were talking about going down to Florida. I was down there and it was cold every day. I mean, it was not nice.
It would be.
Except for Sunday, but I was in meetings, so that helped. But the hotels are always, they keep them cold too, they don't really, but, yeah. If I was actually there on vacation, I would have been more ticked off.
Yeah, that was a bummer.
I'm down in a couple weeks, so I hope it's warm.
What part are you going to?
Cape Coral, right there by Fort Myers.
Oh, yeah, we went over and visited a friend of mine there.
Yeah,
Yeah.
going down for business, but gonna stay a couple extra days.
Yeah. Good for you.
Like hanging that it warms up down there every.
My uncle was just there last week and it was so cold.
Yeah.
So.
I got home I got home today, actually.
The snow on the beach would be cool, but that would be about the only.
10 minutes, it would be nice for
Yes.
pictures.
Exactly. Are you able to say you did it?
Yeah.
But then just one day.
Even when I was watching it for New Orleans, it was like, are you kidding me? New Orleans. And they don't have any clouds or any salt or anything.
No, and don't know how to function.
I did see somebody had their garden tractor, their mower, and they had put a big 50-inch No, TV box on it was plowing snow with it.
Oh, that's funny.
If you don't have a plow, you have to get something.
My granddaughters are in, right outside of San Antonio, and they got snow
Uh-huh.
the day after they put up a trampoline. So they were out there bouncing on the trampoline in the snow, and I'm like, now that would be kind of cool, but
Yeah, wear your coat, your hands.
they were all bundled up.
That's so funny.
That's what they said though, they were like shut down because they don't have any sand trucks, salt trucks, plows, nothing, the whole place was,
Yeah,
business is
I know,
closed.
yeah.
Of course, they're from Indiana, so they know how to drive on it.
Yes.
But that doesn't help when the roads aren't
Cared for.
cared for at all.
Yeah.
They're used to driving on roads that, most of them did.
Oh, there's no.
I'm on the side street, but most of the main roads did.
Am I the only latecomer? Okay.
Well, we were-
That way you called today to make sure that
You were
was
late
coming.
to-
I was late.
Yeah, you texted today, yeah.
Oh, no, I didn't. I texted the ones I had heard from you. I didn't text you.
You thought I got a message today?
Did I? Then you didn't respond to my email last week.
Oh. No, Tara Street, I had a text.
Oh, I did, yes.
Yes, uh-huh.
Okay.
That's okay.
It's okay.
If there are no objections, we will call this meeting to order. And the first order of business is election of officers, and the floor is open for nominations. Basically, we just have president and I guess vice president, right? And
Pardon?
In case the president came.
last year it was me and Dr. Erkey, and
I nominate Dr. Pearson to remain president.
I'll second
really,
that. Before she could object.
it's not a hard job. It really isn't, you guys. It isn't a hard job. You just have to sort of adhere to Robert's Rules of Order.
Except during COVID, it was a bit more, just because
It
everything
was,
was going
yeah.
on. And
Right.
it wasn't really hard to be the president, but just hard to,
Yeah.
to work with. So,
Right,
yeah.
and
But-
it's never fun when Channel 6 News shows up, but,
Oh, yeah, those days were back.
yeah, so, at any rate, do we have a volunteer for, vice president? I mean, honestly,
I just recommend it looks good on a resume.
there you go.
It does look good as you're moving through life.
I say it, my career, my resume is rather a moot point, so.
We've got younger ones here.
That's right. All you young ones need to pad your resume. So,
I mean, I don't mind remaining, but it's whatever you guys want. So.
okay.
Would you like to do it, Sarah?
I did it last year with her, so I mean, I don't have a problem
Okay,
staying
all
with you
right.
another year.
Yeah. And,
I'll nominate Sarah Stewart then to be vice.
okay.
I second. Okay.
All right. Fabulous.
Did you both accept your nominations?
Sure.
Yeah. Do we have to vote on that or just be like, okay, that's it?
I think
All in favor?
both officers are a votable issue, so yes, all in favor.
Aye.
Aye.
Opposed, nay? Okay.
Thank you.
Like I said, thankfully, it is not a really difficult job. Approval of minutes, I'll give everyone a few moments to review the minutes. Which-
I'll make a motion to approve the minutes and just a comment on the HFI report that we received via email. If you guys haven't reviewed that, it was
Very good, very thorough report. I
Okay.
appreciated that that's a lot of work. So that's very well done.
I agree with that. I also thought it was eye-opening just seeing the ranking of our county. Yeah, we've got some work to do. Mhm.
Oh,
Yes. So thank you for all that you did.
are we recording what our ranking is so that in 2 years we can really see what it was? I mean, it might be nice to, our point, I think we were at 91 out of, or 89 or something out of. It might be nice to just have it in record what we were and then seeing if we can move it at all.
Okay, yeah.
To me, that, because I forget exactly what it was, I haven't looked at it recently, but I know that we're right down there.
It's sobering,
Yeah.
for sure. Okay. All right, we have a motion on the floor to accept the minutes. I need a second. All in favor? Opposed? The minutes will be accepted as submitted. Divisional reports.
I guess one question, just for point of reference, what constitutes a state inspection site versus a county inspection site, like this with Cafe Valley? Like what escalates that? I'm just curious.
I'm not 100% because I'm new.
We're gonna introduce Angie in a little bit.
Okay.
I believe the Cafe Valley, by virtue of it being a major manufacturer, is monitored by the state
Okay.
and inspected and overseen.
I think so too, because it's a
I
large
think
commercial.
we
and they-
inspected,
Well,
and
it's
they-
commercial
and
as
they
opposed to
ship things
retail.
out, too. So I think that's part of it, that's part, and I'm not with the, I haven't done any, looked at any foods company in
Yeah,
a
I
very
mean,
long
like I had
time,
my
so.
own thoughts about why,
Yeah.
but like I deal with state level and then I deal with federal level inspections and investigations and things through the hospital. So I thought, well, what is it that triggers it to
I think it's that it's a major manufacturer.
like a food manufacturer rather than just a food distributor, possibly even?
Yes.
So the state didn't come to this. So we passed along the findings to the state.
Correct. Did they follow up or not? I don't know.
Would that not be a reasonable thing to get a follow-up, that they would follow up? Get a report or something? I mean, if whoever reported it here, you don't know if they call back and say, did anything happen? Well, the state inspected, and I just don't know. I don't know what the protocol is.
We don't get reports on Cafe Valley at all.
No, and we don't get any reports on the state inspected facilities, but we do, if there's a complaint, we have to go out and inspect, and then we give that information to the state. The state never does reply back to us on what.
So did you go with them? So they were here when they went?
They were not here.
They never,
Just
they
Dave and I
were never
went.
here.
Well, it says it went on a joint
We
complaint.
went with the environmentalists.
Oh, I see, with the environmentalists, I
Yeah,
see.
because
Okay, I
it
was
was
thinking that, I thought they were
because
here.
What it involved, Dean and I were unsure what we were actually looking for. We don't deal in looking for pests. And we wanted somebody with what they could find, what their eyes could find. So we asked them to come with us too. We can do the food part, we can tell them what, but for them to look into where they were actually supposed to be located at, the pests and environmental could find that. They showed us things that's like, which was amazing, that they said, yeah, that's what that is. It's like, I would have never, I'm not environmentalist.
Yeah, they leave telltale signs behind, and you
Yes.
can definitely
Yes.
tell if there's been
if you know what you're looking at.
Yes, yes, true. Now you know,
Now I
though, so
do,
now you'll be like,
Yes,
oh, wait a
yeah, I
second. Every time you see a little school, you're like, is that like?
Yeah, you are correct.
So when was that?
December, it says.
December.
Oh, that was,
November's last December, so.
oh, okay. Well, with all the election stuff going on and all of, all of that, did something actually happen? That's my concern, that somebody's complained and we have no idea.
If the state followed up,
I don't know.
I do not.
Are industrial inspections public record at the state level? I don't know.
Okay.
I do not know that. I know ours,
That would be
you know,
interesting.
is after a certain time period, but I do not know.
I would think that they would be.
I would think, but you.
But, I've never had that issue. When I dealt with the state, they were always when we communicated really well back and forth. So I never had that issue. Any of the state people I ever talked to, whether it was the bug guy, the pool guy, the mobile home guy, the septic people, they always got back to us. And if they did do an inspection somewhere or a report, they always sent us an emailed copy of that. So I didn't realize that the food division was so different, so.
I don't know.
I'm a little interested in knowing about the new software that is going to potentially be used or is in use, or the geo permit
Yes.
software. Yeah.
That's, GeoPermits is the company developing the software, and we meet with them once a month right now.
Okay.
At this point, it's just the licensing program that they're building, because the program that we issue licenses out of is so old and outdated, it crashes on a regular basis. So that's
So
critical.
is this a
for getting that.
statewide thing then?
No, I mean, it's a company that
County by
has
county?
created programs for many Indiana health
Okay,
departments.
got it.
Or many Indiana offices, period, because they've done an area plan too.
Area plan
Yeah.
also, where you have a geo permit.
Okay,
So, but no, we'll pay them to do it.
okay. I was just curious. And then I had one other, is it public information what pools were closed due to noncompliance?
I thought you might ask.
Oh, it's an environmental.
It was Best Western and Holiday Inn and Gas City. They remedied the situations and they're now reopened.
Okay, so they were hotel pools?
Yes,
Okay,
yes.
all right.
And a lot of times that's just due to a lot of people swimming, and they don't always have a certified pool operator that's there every single day. They've got one that comes in once or twice a week that's on full staff, so it takes them a couple of days before they realize it, but they are tested every single week, I believe, isn't it? It used to be weekly.
It is, yes.
I'm pretty sure it's weekly.
Supposed to be.
They're supposed to be by a separate, it's not just a pool guy that takes a sample, it's usually somebody that goes in and gets the sample. So it's pretty quick to tell when they have bad samples. Yeah.
That's a good thing. So, but those have been remedied and, okay, got it. Okey doke. Let's see.
I'm glad that there's digitalizing going on, of the records and stuff.
Okay, any other discussion on division reports?
And move that we accept the health department division reports as distributed.
Second.
All in favor? Any opposed? All right, division reports are accepted. Health officer notes.
I don't have much tonight, but back to the vital records. Morgan has been tracking pretty carefully what's been happening with our deaths by suicide and overdoses. And in 2023, we had a total of 59 deaths by overdose and suicide, which were high for both of those categories. The good news is in 2024, there were 24 deaths. So over a 50% reduction in the number of deaths by suicide and overdose. There are 5 pending death certificates where it hasn't been determined exactly. So that number could go up. But even if all 5 were, it would be 29 compared to 59. So we're really excited about that positive movement. We're seeing some help with the Core Plus program where they're working pretty intensively with people through Bridges and our relationship with Bridges to Health. And it feels very positive that we've seen that. We also have posted a nurse health educator position, which is part of our HFI monies that we're looking to use to have that person out in the community, really focused on community education for chronic disease management and prevention. Because it's a new position, it has to be posted for 30 days. And so it's in that 30-day window right now. And then with regards to our HFI funds, I had a meeting today scheduled with the new CEO of the Y. It had to be canceled because he fell ill. But we had tried to develop this walking program with our HFI monies, and it just did not get traction. With the new CEO, he's got a lot of energy, a lot of ideas, and he was delighted when he got an email that I wanted to talk to him about this. But I think he will have some ideas to make exercise available to that part of Grant County where people can just come in and exercise, and we can help subsidize some of that with our HFI money. So I'm hopeful for a new relationship with the Y to help promote health.
Also for the South Marion, the wellness center?
Yeah, they did not utilize what we had offered.
They were receptive to it. I think we were offering to fund the program for anybody that needed it, and I think he just, the $1 a day wasn't a big deal for anybody coming.
Right, yeah, so they're already paying it's $1 a day.
Yeah, so.
And then they have the silver sneakers, and then they have something else for insurances, so they're getting, I think, a lot.
Mm-hmm. Yeah.
Okay.
But I think at the Y, with new leadership there and a new vision, new energy, I'm hopeful that.
He's good.
Yeah,
He's
I know, he's very
good.
good. I've actually known him for quite a while, and he just lives out a heart for the community, so.
So, it sounds like the big barrier here is finding a way to incentivize people to participate. And if money doesn't work, then just maybe more vocal public education. I mean, I'm not great at those kinds of ideas, but, how to make that happen. But, I don't know. Mentoring? Yeah, I'm just thinking out loud.
I wonder at Bridges to Health, or can they start marketing to go to their people to go over to walk?
Yeah.
And then even at the walk-in clinics that we have at the hospital, I mean.
Our Indiana Health Center would be another good
At
location.
Indiana Health Center that we get a little postcard or something that we could hand out that says, hey,
This is available.
yeah.
You should do
Like
For
it.
that.
doctors to give to people, instead of just telling them, contact the Y, just actually have.
With the phone number to contact them on, or,
Yes.
yes. Because all the people Bridges, Bridges Health, I don't know if they would, but, you know, the walk-in clinics and stuff, many of them
Yeah.
don't have a healthcare provider to be able to tell them, like a Dr. Bragg, to say, hey, you can go walk. So they don't even have one, that's why they do the walk-in clinic or the ER. Even in the ER might be, you know, for people coming into the ER. But
Do you remember, there was something a couple years ago that, were there kiosks put, is there one at Bridges?
a what?
It's like a kiosk that has information about all different kinds of community resources and things like that. And I can't remember
It used to
who
be
was
around.
behind it. Oh, was it Carry Services that was doing
We had
that?
one at our church, but it's no longer there. They put them all over the place, but I
Yeah.
don't know that it was sustained.
Yeah, I don't know. And I can't remember what organization was doing it because I thought that's a good way, like, for people to,
You
like, to
mentioned
spread
information out
information.
there,
We were just
sure.
talking about it because we have to do our community health needs assessment. I'm like, I wonder whatever happened to those. Like, that would be a way to communicate. But I can't remember who did
Carry
it.
Services would be another one to
Mhm.
let know about it.
Sure.
They have
And
a-
how about the Veteran Service Office, the VSO office upstairs? They do have I was just in there trying to get some benefits for my mother-in-law, but at any rate, they have a thing where, on their wall with all kinds of slots for brochures and business cards and things like that. Yeah.
Yes, social media, the state is providing social media training for, and then we have somebody from each division that's sitting in on it. Morgan is our social media guru, but it has provided some good insight and ideas. So it's hard to know how to reach people now. It just is.
True story.
Do you know, have you been getting applicants for the educator position?
No, maybe 3. And
I mean, I know I shared your post that you had on social media on my social media and was like encouraging some nursing friends to consider it, but I just
I
didn't know.
didn't see that social media.
And what will that job entail? Is it,
A lot of it will be partly created by the person. So
Okay.
they need to come with a vision of how do we educate the public on, and then they have to have the ability to actually teach and get out into the public spaces and address our chronic disease issues and smoking prevention, cessation, just all of those needs, weight management. So we're looking for just the right person, but we decided they needed to be licensed as a nurse so they could do other jobs within the nursing division, like immunizations and things where when people are gone, vacations, we just have that coverage to fill that
This
office.
is a senior center. When people come down to the senior center, that would be a good population to encourage to walk to.
yes, we've talked about that, and
They periodically have Valentine's Day, they'll have a cookie or something. They have, and people come and sit around and all the funeral homes and nursing homes come and supply goodies.
yeah.
They do that on a regular basis. Chili cook-off, it's done by chili to die for, I say. But you get all your information about all the senior services, kind of. It would be interesting to see if we could have a little table there that would say, hey, if you're interested, especially in the winter, people right now can't get out because it's winter. It's too cold. So.
And tying into what you said previously too, I was thinking the recovery community, if we could maybe, market this through like some of the larger Celebrate recovery groups, New Life with the AA groups, et cetera. So as we're talking about preventing fatalities and overdoses, knowing that exercise becomes such a big part of recovery, that may be a good link as well.
Very good idea.
That's all I had.
all right, any old business?
I don't have any old business, but speaking of how we used to have each head of the department would come in during these meetings. And it is nice that when we have questions to be able to talk to each head. And, you know, Tara does a pretty fine job of trying to give us all the answers, but she's got a lot of hats she wears too. So I think we originally started doing that kind of like around the COVID time, and I think part of that was to try and, you know, minimize how many people we were having come into the
Having to
meeting.
tell and retell and tell.
Yeah, you know, but, you know, there are times that we need to, you know, there's
So
some.
you would like department?
Yeah, I mean,
Well, didn't we have a rotation going for a while? Somebody from nursing would come in, somebody from septic would, but it'd be like over the 5 meetings? We used to have somebody come in.
Well, there was a time when we were trying to do some educational presentations by each department to kind of educate the health board on what we do.
I think that's still necessary.
I think it would be great for all of us. I mean, and like that, for the most part, most of our meetings are pretty short, you know, they're once every couple of months. And I get it, like everybody's busy. I know Jeff specifically, he works a couple of jobs. I don't know about everybody else, but, you know, I know it's kind of hard sometimes because he has to go to another.
Sure. But isn't that one of the reasons we decided to have our meetings at 5 o'clock? So that the division,
But they all get off at 4, don't they? Everybody gets off at 4, so then we're making them wait for an hour, and do we
Yeah.
pay them that hour? They sit here and do whatever, and then do they sit for an hour and get paid too? So,
Right.
I mean, so that was all part of the decision of, are we gonna have everybody come and sit here? And not.
Well, and I
be
don't
paid?
think we necessarily have to have them here every single time, but if there's gonna, you know, kind of, I guess we never really know.
Yeah.
Maybe we
No.
could, well, when we get the division reports, because you usually get those to us.
I try to get them out the Wednesday before the meeting.
Yeah, if we've got some questions, maybe then we could say, hey, can you have, you know, the head nurse or.
Or somebody.
Yeah,
Yeah.
whoever it is we have questions for, could you have them come? We'll try to get to them first thing, and then they can get out of here, so they're not having to stay for the whole thing.
Yeah, because I mean, they're either paid overtime or get comp time for beyond the 35 hours.
Right.
So,
And then there are rumblings that the new commissioners are gonna not want any more comp time, so.
Yeah,
I don't know how
I
accurate that
get it.
is.
Believe me, I get it.
Are they 35-hour a week employees? Oh, I did not know that. I thought they were 40.
Well, I think that's changing. Maybe that's changing too. I don't know.
They said they were changing it to 40, but the way I understood it, they're still working 8 to 4. So, and they get, instead of a non-paid lunch, they get a paid lunch.
We get right now, county employees work 35 hours a week and do not get a paid lunch. My understanding is it would still stay 8 to 4. That's if I'm understanding
Yeah,
the rumor
yeah,
correctly.
Well,
It would still be
and
8 to 4, but with a paid lunch. That was what it would be.
yeah,
Right now, it's
that's what
without
I was
paid lunch,
understanding.
and it would
And I'm
be
like,
8 to 4
okay, I don't know
with
how that
paid
worked
lunch. And I
out.
don't understand the difference at all.
I don't
Actually,
either.
it seems kind of odd that we pay them to work their lunch. I mean,
It was part of the raise this year, so I don't know what the council did. I didn't pay attention.
I have no idea. It's irrelevant. I don't want to work till 5, that's fine.
8:30 to 4:30.
No.
That's still 8 hours though.
but with no breaks.
okay. That concludes old business. Let's move on to new business.
This is Angela McCollum. She goes by Angie. She is our newest certified food service safety officer. And if you guys want to introduce yourself to her, that would be great. I just told her she had to come and meet the board.
Hi, I'm Dr. Holtzman. I'm a psychologist at the hospital. Good to meet you.
Nice to meet you.
I'm Brandy Poling. Previously was an environmental health specialist. Now I work for Chuck Sewer and Drain. So, to the contractor side.
Barbara Erke, I'm a nurse.
Okay, Denise Pearson. I'm a veterinarian.
I'm Sarah Seward. I'm risk manager for Marion Health.
Well, I'm Angie McCollum, and I'm your new health inspector, so.
What brought you here?
Well, I needed a change of job, so I worked at Mississauga Community Schools for 22 years in the food. I was a manager of RJ Basket Cafeteria, for 12. Oh, I love the kids. They're just, they're great. They really are. I do miss them on occasion, so.
Horrifying words you ever heard, food fight? No.
Right. No food fight. No, it was fun. I enjoyed the children, but I needed something a little bit, well, something different. But this is, I mean, it's different, but it's challenging. It's learning. I've got the backgrounds on the food, and I know how schools do it, and I know, but it's learning everything on top of that, just, certain, like the state versus, or not versus, but the state and, the county does this, and we do that, and they do, it's just trying to get all the new things, in here, and and the programming of my lunch lady eyes, I've got to, I've been told, I need to calm down the lunch lady eyes on some, not these guys, but some inspectors say, you need to not see with your lunch lady eyes. And I have some say, oh no, continue using your lunch lady eyes. I don't think I'll ever not use my lunch lady eyes. So, but that's.
Have you enjoyed it so far?
Yes, I have.
When did you start?
August the 5th of last year, so about 6 months. Yeah, so I've done, still, I haven't done every business, I haven't been in every business, but I've done the schools and a few of the other, a few restaurants and a few grocery stores. The grocery stores we usually go together because they're so big.
Yeah.
But, but I haven't done a whole lot of colleges we do together, they're huge.
You have 3 here in the county, right?
Yeah.
Or 4? No, 3.
No, we just have Taylor and IWU.
Oh, I guess Audi Tech doesn't serve food.
Yeah.
Oh, okay,
Yeah, it's different. It's interesting. I'm learning stuff every day. So I do like, as soon as I think that I know something and when something else changes up, and it's like, oh, okay. So, but yeah, I do enjoy it very much.
Good.
Thank you.
Welcome. It sounds like you're wonderfully qualified to do the job. Awesome. Okay, public comments.
That's you.
Okay, well, if there's no other business in front of the board, I would entertain a motion to adjourn.
So moved.
Okay. All in favor?
Aye.
Okay, we are adjourned.
Thank you.